Hi there, my name is Aoife McDonald and I'm a registered dietitian, and I'm delighted to be recording this video today for Kilkenny Libraries as part of their Healthy Ireland at Your Library programme. So this short video is going to be all around the topic of nutrition for men's health, so I hope that you find it interesting. So just to give you a little bit of background about me before we get into the talk. So I'm a dietitian. I've been a dietitian for over 7 years now. So I studied nutrition at UCC and then did a postgrad in dietetics in the University of Chester. I'm the founder of the Digestive Health Clinic, so I work a lot with people who have digestive conditions. I've also worked in hospital settings, private practice, and workplace health and well-being. So that's just a little bit about me before we get started. So now to get straight into the talk. So I'm trying to cover kind of the main topics in terms of men's health over the next 10 to 15 minutes or so. So on the left-hand side there, you can see some of the main topics that we're going to get into in today's talk. So first of all, we'll talk a bit about fibre, what fibre is, why it's important, where we get it from. Heart healthy eating. So heart health, particularly as we get older, becomes even more important. So we'll be talking about different ways to optimize our diet when it comes to heart healthy foods. We'll talk about reducing things like salt, sugar, and fat. We'll talk about alcohol intake and what we should be aiming for and what a unit is equal to. And then finally, we'll talk about kind of red and processed meats and the kind of limits that we should be implementing in that case. So into the first topic. So the first topic is all around fibre. So we've probably all heard about fibre before, but what actually is it? Why is it important? And where can we get it from? So fibre basically is part of a lot of our kind of plant foods. So it's present in a whole host of different foods. For example, different whole grains, or fruits or vegetables, nuts, seeds, and things like lentils, peas, and chickpeas. So we get fibre from a lot of different foods, but we know that most of us actually don't eat enough fibre. So as you can see on the slide there, we're aiming to eat 30 grams of fibre every day. So 30 grams is actually quite a lot of fibre, and most people unfortunately do not hit this target on a consistent basis. We know from the studies in Ireland and in other countries that on average we're only eating around 18 or 19 grams of fibre every day, so a lot less than that 30 grams of fibre that we should be aiming for. So why is fibre important? Well, fibre has a number of different roles in the body. We know that those with the higher fibre intake tend to have a healthier gut, a healthier digestive system. They tend to have lower risk of things like liver and fatty liver disease, and things like heart disease and type 2 diabetes. And they also tend to be at healthier weight also. So there's lots of reasons why we should be trying to incorporate more fibre into our diet. So when it comes to fibre intake, it can be a good idea to start looking at maybe labels on different things that you're eating. For example, breakfast is a really good time that we can actually get a lot more fibre into our diet. So for example, some breakfast cereals you might see might have less than 1 gram of fibre in a bowl of cereal. So if we're starting off our day with a low fibre breakfast cereal, it can be really hard to then hit that 30 grams of fibre over the rest of the day. So even starting off with breakfast and trying to go for a higher fibre cereal, whether it's something like your oats, your kind of brown bread or high fibre bread, or other high fibre cereals like your Weetabix, or shredded wheat, things like that, or all bran are kind of high fibre cereals. So what you want to look for in your cereal is that there's kind of at least 3 or 6 grams in every 100 grams of the cereal to know that it's either a good source of fibre or that it's high in fibre. Other ways you can add additional fibre to like your breakfast, for example, would be adding things like seeds or nuts into your breakfast, or adding fruit, well, whether it's dried fruit, frozen fruit, fresh fruit, all of it's going to contain fibre. So try to have a little bit of everything within each of our meals to get in as much fibre as possible. So like I mentioned there, nuts is a good source of fibre as well. So nuts can be really versatile, either as part of a snack, either chopped up and added into cereals, or having it, in a stir fry, like cashew nuts and stuff like that. or into salads is a really good way as well coming into the summer months to incorporate more of these types of foods in the diet. And ideally, we're looking for unsalted, unroasted nuts when we're having them. Seeds then, so there's lots of different types of seeds. So things like chia seed and flaxseed or linseed in particular are very high in fibre. So they can be really good to add into soups or stews, cereals, yogurts, smoothies, anything like that. So they're great to include if we can. Or cereals or breads then, so trying to go for high fibre things. So going for brown rice instead of white, going for whole wheat pasta instead of white, going for a higher fibre bread versus a white bread and so on. So trying to make little swaps like that to get you closer to that 30 grams per day. Getting in at least 5 portions of fruit and veg every day. So that might be 2 fruits and 3 veg or vice versa. But on average, trying to get in 3 portions a day, either from fresh, frozen, tinned, trying to get it in kind of any way we can really. And then on the bottom right-hand corner there, we have our pulses. So this is referring to things like chickpeas, beans, lentils, which again are really, really good for the gut, really high in fibre. So it might be that if you're making a bolognese, for example, that you reduce the amount of mince you're having and maybe add in some kidney beans or add in some lentils, for example, to increase the fibre content. Or things like chickpeas, for example, are really, really good in terms of adding into soups, adding into salads, or if you're having a chicken curry, for example, you could reduce down some of the chicken and add in a tin of chickpeas, for example, instead. So there's lots of ways that we can adapt what we're currently eating and little swaps that we can make to try to increase the amount of fibre that we're eating. So with increasing fibre intake, we'd always say try to do it slowly. So you don't want to overnight go from eating a low fibre diet to a high fibre diet, because that would be too quick for your gut. So we need to kind of do it slowly. So gradually making changes over a couple of weeks and gradually adding more fibre into your diet. And what's really important with our fibre intake as well is that you're actually drinking enough fluid. So fibre and fluid work together. So if we're increasing our fibre intake, we really want to ensure that we're also drinking enough fluid. Otherwise it can cause like digestive discomfort or constipation. So it's really important that you increase your fluid intake first and then start gradually increasing your fibre intake if you don't have a great fluid intake at the moment. So another topic that's really important for men and for women is looking after our heart health. So as I said at the beginning, our heart health, of course, is always important, but as we get older, we do develop a higher risk of things like having elevated cholesterol, high blood pressure, and so on. So we really want to focus on adding in lots of heart healthy foods into our diet. So as you can see in the slide here, I kind of included lots of different foods that we know that are beneficial for our cholesterol levels. So kind of in addition to the previous slide, kind of all the foods really in the previous slide as well are high in fibre and therefore good for our heart health. And these are just some additional ones there to include on top of what was in the previous slide. So in terms of like cholesterol, so it's important that if you're getting your bloods done, find out what your cholesterol level was. You can kind of track it over time to see, is it high? Is it increasing gradually over time? And you can kind of make dietary changes then based on those results. So really important to kind of to understand and interpret any results of blood tests that we might be getting done. So of course, when it comes to our heart health, a lot of the focus tends to be on taking foods out of our diet. So with foods we want to take out, we generally, when it comes to cholesterol, we want to reduce our intake of saturated fats. So we want to be eating less processed foods, less pastries, less biscuits, less cakes, less fatty meat, less takeaways, less cream, less butter, and so on. So they're the kind of foods that we all kind of know we should be maybe eating a little bit less of. So we want to be reducing down those foods as much as we can and trying to include more of the high fibre foods in the previous slide and including some of these kind of heart healthy foods here as well, which we'll have a chat through. And these can be really protective for you as we grow older. So we'll run through some of the foods here. So you can see salmon or kind of an oily fish there in the corner. So we know that for our heart health, we should be having 1 or 2 portions at least of oily fish every week. So that might be anything like salmon, mackerel, sardines, herring, trout as well. So trying to include oily fish. So it can be like your fresh fish, even like tin salmon, for example, or tin sardines. They're going to have really high levels of omega-3 fats as well. So we want to include them for that reason. And I guess the reason why we want to include omega-3 fats is for their beneficial or kind of anti-inflammatory effect in the body and for having a positive impact on our cholesterol levels as well. So that's why we want to include more oily fish. If you don't eat fish, for example, you can get omega-3 or fish oil supplements to get the omega-3 from them. Or if you happen to follow a plant-based diet, you can get some omega-3 from things like soya, things like flaxseed and walnuts, the different type of omega-3. But you can also supplement with something called algae oil. So if you are kind of following any particular diet, it can be good to get individualized advice on this to make sure you are getting all the nutrients that you need. So another food besides the kind of oily fish that we know is good for heart health would be soya. So that would be anything made from soya beans. So it could be soya milk, so soya yogurt. It could be things like tofu as well. So these are beneficial because they're naturally very, very low in fat, and they can have a cholesterol lowering effect. So including these throughout the week can be a kind of a beneficial swap as well. We have oats in there as well. So there's some oat kind of cereal oats there, or some oat crackers or oat cakes in the diagram there as well. So including more oats in our diet has been shown to be really beneficial due to something called beta glucan, which oats contain and also that barley contains. So it's beneficial to include things like oats regularly, if we can. Along with that, things like nuts, which we kind of talked about in the previous slide, but we know that from research that including a handful of unsalted, unroasted nuts every day can help to reduce cholesterol levels when done consistently. So if you do have high cholesterol, then it can be beneficial to include more nuts in our diet. And then kind of along the bottom right-hand side there, I've just included some kind of products that are available that contain kind of our plant sterols that basically help to lower our cholesterol as well. So different spreads you can get, different drinks you can get that can help to lower cholesterol as well. So there's lots of things that we can add into our diet when it comes to our heart health, on top of the things that we kind of want to reduce. So the next point is looking at reducing our intake of things like sugar, salt, and fat, particularly your saturated fat. So we know that fat refers to a whole host of different types of fat, but really we want to be reducing the saturated fat in the diet and having more of the kind of healthy fats in the diet, like the types of fats that we get from our oily fish and our nuts, our seeds, and olive oil and stuff like that. So as you can see, this is the food pyramid. So you've probably come across this in the past. So as you can see at the top of the pyramid, this is kind of representing the foods in our diet that might be high in fat and sugar and salt. So ideally, we want to really kind of limit and reduce our intake of these foods, just because we know that excessive intakes of these can have a negative impact on our long-term health. So have a think about maybe how often you do include these foods. So it could be any kind of fizzy drinks or chocolates or crisps, cakes, and so on. And even with salt, like if you're adding salt to your meals, for example, that can easily kind of put us over our kind of salt needs for the day. So we know that even if we don't add salt in cooking, a lot of the foods that we typically buy anyway can be very high in salt. So most of us are eating too much salt even without adding any salt to what we're eating. So particularly if you have kind of high blood pressure or anything like that, then looking at reducing salt in your diet or reducing the amount of foods that contain added salt can be a really good idea. So yeah, so trying to kind of limit the foods there at the top of the pyramid. And as you might move down the pyramid, then that's where we're kind of increasing the amounts of those types of foods in the diet. But this is kind of a good guide in terms of the different food groups, what a portion size is, and how many portions per day we should be having. So this slide just touches on alcohol. So alcohol, obviously in excess, we know is not good for us. So the government has developed kind of low risk alcohol guidelines for the general public. So the alcohol limits for men and women are different. So women generally are smaller, have a smaller liver, so therefore can't tolerate as much alcohol as men. So that's why the alcohol limits are different for men and women. So for men, basically, we don't want to be exceeding 17 units in a week. So ideally, we want to have at least 2 or 3 days in the week where we're not having any alcohol. And then if we are having up to that 17 units per week, we want it to be spread out. You don't want it to be all in 1 or 2 nights. You do want it to be spread out over a couple of days, really, if you are kind of having that level of alcohol. So it can be useful to kind of understand how many units is actually within a drink. So sometimes we think, one drink must be 1 unit, but typically that is not the case. So for example, in the diagram here, you can see for a pint of lager, for example, that half a pint is actually 1 unit or one standard drink. So typically if you're having a full pint, which we probably, you would be having a full one if you're having one, that would actually be considered 2 units or two standard drinks, as opposed to one, for example. So if we take that into account, 8 pints in a week, for example, would be the upper limit of alcohol intake. So similarly for wine, as you can see in the diagram, that 100 mils of wine will count as one standard drink. But, in most cases, if you pour yourself a glass of wine or you're getting a glass of wine out, it's typically much more than 100 mils, that you would get. So typically if you're having a glass of wine, it's probably 1.5 to 2 units or 1.5 to 2 standard drinks as opposed to one. And then in terms of like spirits that you might be having, then a pub measure, which is just over 35 milliliters, is considered one standard drink there as well. So just have a think about whatever alcohol that you might drink, if you do drink, how much you might have and how many units you may be consuming in a week, and whether you need to look at reducing that down. The final thing I wanted to touch on then for kind of nutrition for men's health is around the topic of red meat. So red meat refers to things like beef, lamb, and pork. And we know that from the research that eating, very high amounts of red meat can have a negative impact on our health and can increase our risk of certain conditions. So we don't want to be eating too much red meat. So in terms of the advice from the Irish Cancer Society, they advise not eating more than 500 grams of cooked lean red meat, which is 800 grams of raw meat in a week. So kind of saying that's kind of the upper limit and trying to keep below that if we can. So of course, it's still really important to get, nutrients in our diet and protein, within our meals and stuff like that. So it could be that if you're having red meat, most days of the week, that you look at replacing it with some alternative protein sources, whether that's your chicken, your fish, or even plant-based sources of protein like beans or chickpeas, lentils, or tofu. So we just want to be careful in terms of how much we're having. So in the case of processed meats, so that would include things like sausages, ham, salami, rashers, and so on. These would kind of be treated separately from red meat. The advice is to really limit them, as much as possible. So only kind of on occasion, just because of some of the health risks associated with having high amounts of those foods. So have a think about your red meat intake, your processed meat intake, and whether that could be reduced, and maybe you could replace some of those foods with some of the alternatives listed there. So that's kind of a quick video in terms of nutrition for men's health. So I hope that you picked up a couple of tips there with that. If you have any questions or queries about it, my contact information is there if you do want to ask any questions. So I hope that you found it useful, and I'll hopefully see you again soon.